Hi everyone, sorry to keep you waiting in the lobby there. Thank you for meeting with us today. I'll just start here. I'm just going to start sharing this screen. Can everyone see that? Now that I can't see, that's okay. Karina, can you see that? Just give us a yes.
I can see it. It's still in like PowerPoint format, not presenter mode, but we can see it and that's all good.
Okay, fabulous. That should be right. Yeah.
Yeah, I saw you clicked it and it just didn't do anything.
Okay. All right. But that's not full screen now, or it is?
It's not, which is
Okay,
strange.
that's all right. We will run with this. We've been having a few technical difficulties. Before I get into it, I just like to do an acknowledgement of country. I just like to acknowledge the traditional owners and custodians of country on which we're meeting today and pay my respects to the Whadjuk people of the Noongar Nation. I'd also like to extend that respect to peoples in this room today and joining us online. I'd also like to acknowledge that sovereignty was never ceded and it always was and always will be Aboriginal land. So we are meeting here today to run through our exciting condom wallet competition launch. It's been a bit of a long process getting it off the ground, and we are so excited to share the designs with you. So I'll just introduce who we've got here today. So myself, I'm Liberty. I'm with the Aboriginal Health Council of WA. I'm acting as the project coordinator for sexual health and bloodborne viruses. And maybe Zoe, would you like to introduce yourself?
Hi everyone, I'm Zoe. I use she, her pronouns. I'm a Murray. My mum's Bindle and a Barinji. But I came over here about 4 years ago to do my master's in sexology, and I am the project coordinator at the YACWA project, which stands for the Educating Peers project. And I'll tell you a little bit more about that later on.
Hey everyone, so my name is Amber. I'm a Congolese Imam woman. I was born on Balladong country in WA though, and worked here my entire life. I'm with the Council of Aboriginal Services WA as the Senior Project Officer, and I designed one of the wallets. That's why I'm here.
Very excited to have you here, Emma. And we've also got Karina joining us online. Karina, would you be able to give yourself a little shout out?
Absolutely. Hi, everyone. My name is Karina. My pronouns are she, her, and I am the coordinator of the Population Health and Community Development team at WAAC, which involves a lot of education, outreach, and of course, handing out and designing the safe sex packs that we're chatting about today. Thank you so much for having me.
Wonderful. So we'll get into it. So I guess we wanted to just sort of discuss briefly just the process on how this sort of came about. So there was some funding available, and we thought what a cool idea to work collaboratively with the different organisations and work on this cool thing, because I'm sure, as you're aware, WAAC have had very cool previous designs, and we're like, why not open that up to the greater public and start to get some different voices for these cool designs. So we put that out to the public, and we started receiving quite a few designs in. And then we were sort of like, how are we going to, make this a fair process of deciding who wins? So we actually ended up printing out all of the designs, and we had our sexual health teams workshop earlier this year, which is a 2-day workshop held down here in Wooloo, and that brings together people from all the different regions across WA, and we gave everyone some stickers to have votes, and then throughout the morning teas, lunch times, afternoon teas, people were able to have a look, cast their votes, and we sort of increased the votes from there. We also put up to an online vote, which we got some feedback for people being able to choose their favourite designs. So we will get into it. So I've got all the designs here. I'm sorry that it isn't great screen. Oh, just a bit of housekeeping. Karina, I might get you to help with monitoring that, because we are having some difficulty seeing everything over here. But if you've got any questions, just pop your hands up or pop them in the chat. And just to let you know that this is getting recorded today. So
Liberty, sorry, before you crack on, I don't think the slides are moving. We're still on the front slide.
okay.
Yeah. Oh, here we go. Yeah, now it's
Okay,
moving.
I have no idea what is going on. Slideshow. Oh, we'll just go from current slide. Is that up now, Karina?
Still in PowerPoint format, but we can see the right slide.
Okay, no idea what is going on. Anywho, we will start here with our first design. I'm just going to get that down then, and notes. That's okay. Beautiful. So what we have here is our first design, and we have another one of our AHCWA employees. This one was done by Brandon. Love this one. So it was the big old design. And as you can see, we've used the peach emoji, the beautiful WAAC comms team. So we got the original designs, and then they got a bit zhuzhed up by the WAAC comms team. And then they sort of incorporated that, the inside. So as you can see, the blue on the left is the outer wallet design, and on the inside there is the inside. So that all gets folded up, and it gets a piece, a condom and some lube placed in there as well.
The
Everyone was
final
like,
product.
this one in the office because like, is it an insult or is it funny to give it to your friends?
Both. Yeah. I mean, it definitely could go either way. Absolutely could go.
But we were like, this is the one that we would most like give to a friend.
Yeah. Also though, yeah, if you're giving it to friends, you're promoting that safe sex and getting that conversation starting.
Which I think this competition was amazing for in the office anyway here. Like as soon as it was out in line, everyone was out in the office, like kind of designs together.
Yeah, it was cool. So moving through here, then we have got our banana coat, which, as you might know, banana boat, the sunscreen, gives you good sun protection, SUN, but then they've got the great SON protection, which I think is very clever. I don't read that. So I believe this design came from up in the Pilbara from memory, and also the inside. I guess take that little splodge how you want to. Is it sunscreen? Is it another bodily fluid? We don't know, but we're protecting the fun. I guess that could also be change some wording there too. Karina, I don't know if you know too much about like the comms team, if they were with you when they were deciding like on the internal parts of did they give you much feedback on it, or was it sort of just like they were left to their own devices?
I think they were sort of left to their own devices. Luckily, we have a really funny and very good graphic design team here. So they ran with the original concepts that were given to them and then just did a bit of zhuzhing on what they thought might look funny. So yeah, super happy with the end product with that.
Yeah, they look great. So moving on, we have this one. So there's very subtle differences on these two designs. This is the outside, and this one was also developed. This one came from Ash, who I don't think he'll mind me chatting on his behalf, who works in the AHCWA office in our design team, communication design team. So we're looking here. Like we've got the vaginal cavity, we've got the condom, we've got our sperm. He's saying, sorry, you can't pass. And even that's been come on here from the WAAC team that even though that condom's coming off, that they can't pass either. I was talking to Ash about his design process for this one, and he said he drew a bit of inspiration from old comics, like the ones that you found in the newspaper, like Garfield or those sorts of things. And I feel like you can really see that. Like when he said that, I was like, oh yeah, this is like those, different I don't even know the words with comics, like slide, the speech bubble,
Like a story.
the story panel, storyboard, which I was like, that actually really does sort of, it tells that story, which I think is really cool. And I don't know, it's nice to hear that background behind that design process as well. Okay, the Little Mermaid. This one's also been quite the fan favourite. So as you know, the Little Mermaid, and then they very cleverly changed it to the Little Mermaid. And then they have used a cartoon graphic of a clitoris here. And then also love that input of the internal design there of darling, it's better down where it's better. So I think that one's really cool. It's been, all of them have been super, super well received. So
that one was designed by Fran. She's a sexologist and she's based in Geraldton. So yeah. Her design.
And you can't see on the packaging, but we did actually have to write, oh, you can't see in that either, but it says not affiliated with Disney. So
yeah, I think these are the final draft. So I don't think they had the disclaimers on them. But yeah, good to know. We're trying not to get sued. Hopefully don't. It's all for a good cause, so maybe not. So that one's cool. Moving through, this one's great. So this, we've got the outside is the Can't Even Condom, the inside, the What's This Then. So you might be aware of Stephen Oliver, super incredible comedian. So this one stemmed from him. And this one took a bit of this one. This one was a difficult. Do you want to speak to that?
I can speak to it. The original design was of Stephen Oliver's face that said can't even. Oh no, I think it was the face and that said what's this slut. So we really wanted Stephen Oliver's face on it, and I tried my hardest to get in contact with him so that there was some approval. But he's not on any socials except for Facebook, and like Facebook's like monitored by someone else, and yeah, I couldn't get a LinkedIn, nothing. I couldn't find him anywhere. So it was really
his agents and stuff.
Yeah,
I
contacted one of his old workplaces. I was like, nah, I'm not this one now.
Find his third cousin on Facebook.
No, literally.
When is it harassment?
Yeah, I was like, I think I should stop. So yeah, we had to pivot and just use just the text. But I think it was cleverly designed in that it's the font from Black Comedy. So it's got the Black Comedy font on the inside and outside. So if you know, you know.
You know
like,
exactly where it's from.
Yeah, exactly. So yeah, it turned out really sick.
It did. Yeah, I think that's cool. I think that's very, very cool. Hopefully we can try to get some. We'll get some to it, but somehow we'll make it happen. All right. And then I believe this is last but not least. Take it over, Emma.
Yeah, so I mean, we were riffing in the office a little, like I was saying earlier, with Brandon as well, who did the big old one. And we're like thinking like protective gear, like PPE. We're also in WA, like mining country. Everyone's in high vis, and we're just like covered up with almost like wooden PPE. But kudos to the design team because the inside shocked me when I opened it. I wasn't ready. It was great to see like the outcome from like my very dodgy Canva, using the word Canva as well. So I've got to delete that off there. And then seeing the finalized product. I obviously work in the Office of Liberty, so it was great to have you come in with my big pack of condoms and throw them at me. I told you this story as well. I got at the train station, I was going home and they're doing like a searching thing at Freo Station, and I had to open my handbag and it was just like, how many was it? 50?
50.
I had 50 condoms. I looked at the cop and I was like, oh, I just won a competition. He was like, congratulations, I guess. Searching for knives, found 50.
I mean, it's protection of some sort.
So I nearly gave him one, but I was like,
again, it's inappropriate. And I wanted to just give a special shout out. I think we do have Aaron online as well, who I do believe was the designer of our meme winner as well, which I don't think he's seen this. This could be quite exciting. So the next one is your cover your knob, protect your mob, which I think is just like, it's perfect. It's all it needs to be. It's just great. And we had some really incredible designs come through from Aaron, who I do believe is with us today. So just wanted to shout that out to him. And yeah, I think it's great. So we'll start to be bringing these out onto our social media tiles as well. So stay tuned and look out for that one. So that brings us to the end of those. I do apologise, guys, for the changes in these PowerPoints. I have no idea what's going on with this. But now we're just going to pass it around to the organisations that are with us today. So thank you, Emma, for that spiel. That was amazing. But I'll just hand over to Zoe, and Zoe will give us an update on the Youth Educating Peers and what they get up to.
Yeah, cool. Thanks, Liberty. So like I said earlier, I work for an organisation. Well, my project's called the Youth Educating Peers, or the YACWA project, and we are under the Youth Affairs Council of WA, also known as YACWA. So we're the peak body for young people in WA, kind of like, I like to say, like the middleman between young people and government. So trying to, advocate for young people and also give young people access to government kind of documents, but, breaking it down in a real youth-friendly way. So one of our projects there is the Youth Educating Peers, which is a sexual health and bloodborne virus and also respectful relationships project, and it's a youth peer project. So we hire young people under the age of 25 to do the education, so specifically with young people 12 to 25, and also to create our resources, and we're all over socials, so to create all of our social media resources, and we also do sector capacity building. Our main sector is the youth sector, so youth workers, case workers, things like that. And then on that, we go into, we don't really go into schools or anything like that. We go into youth settings. So we usually go to drop-in centres or resi care or, care schools. If there are schools, they're usually care schools. And then the top, as you can see on the screen there, the topics on the right are the things that we cover. So we do stuff around safer sex, consent, relationships, STI and bloodborne viruses. We also do stuff around sexting, online dating, pornography, and we do LGBTQA plus 101. So we do that in the youth setting and also with professional development. And we also have a arm that we're able to do some consultations, so some more catered support for orgs that want some support around any of these topics. We're funded by the Department of Health, and we've been running for 16 years, so we've been around for quite a while. We've had different kind of makeups of the team, but we've always at the center of our team is that we do peer work. So all of our young people are, the heart and center of the work that we do, and in that we have a larger team that we do youth reference. We have a youth reference group that we meet with young people and see what resonates with them. So like these designs were forwarded to them to see if they wanted to vote on them, etc. I think, I'm trying to think what else is relevant to know. We are, I don't know if anyone in the room is from Broome, but we're coming up to Broome at the end of August. And we're doing some professional development sessions with some different orgs and stuff, but we've still got availabilities for youth sessions. So if you have any connections, we've reached out to all of them, but not had the best in booking some in. But if you have any connections with, PCYC or the Youth and Family Hub or anything like that, please help us in any way. That would be really helpful. I think that's all from me. Yeah, thanks.
Awesome. Some incredible work. Thank you, Zoe. Karina, do you want to take the floor for the WAAC overview, please?
Thank you. So I'm here representing WAAC, which is formerly the WA AIDS Council, and we were established in the 1980s in response to the AIDS crisis of the time. While our core focus still remains to support people living with HIV, because the landscape of HIV has changed so much from those very high rates of notifications in the 80s. We've now got treatment that can support people living with HIV, meaning that HIV doesn't turn into AIDS. And so we now do a lot of broader work around making a difference around HIV, other STIs, other bloodborne viruses, and sexual health more broadly across WA. And we do this in a number of ways. So today I'm representing the health promotion and community development team. And so a lot of the work we do is with community around sexual health education. We also do co-design of projects, and that might look like a campaign or resource development. We obviously hand out the free safe sex packs. Fun fact, last year we handed out 110,000, so they are definitely in demand and are a bit of fun. We also do outreach at events, which might look like a stall where we're having interactive information and games for the community to engage with, or with the sort of guise of normalizing conversations around sexual health and reducing stigma around STIs and BBVs for better health outcomes. And we also work on projects such as Levers, which we go down to every year. And we do a lot of training and professional development to workforce, and that really is workforce in any capacity, whether it be healthcare, health promotion, youth work, any sort of community service. We understand that everyone has a role to play when it comes to sexual health, and we provide inclusive practice and specialised topics around that kind of training. And then we've also got a few other things on the go. A lot of our work centres around supporting LGBTQIA plus young people through our Freedom Centre, and that is not only a social support centre in Leederville, but also counselling and community development, which is available free of charge to regions across WA, including Bunbury, Geraldton, and Kalgoorlie. And we have our sexual health clinic, M-Clinic, which is based in West Perth for men who have sex with men and any gender diverse people. We've got a gender affirming care centre, which is fantastic. And then we provide clinical support around testing and treatment of HIV and other STIs, prep scripts, vaccinations. The nurses are wonderful there. And we also have in the orange box there is our needle and syringe exchange program. So that's a really great service. So we have a van that has injecting equipment that can be exchanged with community members who inject drugs. Obviously a huge harm reduction standpoint. Have both the van that goes out to several areas of the Perth Metro, including Rockingham, Mirrabooka, Belmont, and a few more. And then we have offices in West Perth and Fremantle that also provide that service. So a lot of the work we do does take a peer lens and harm reduction around sexual health, HIV, STIs, and BBVs. Yeah, I think that's it from me. Thank you.
Awesome. Thank you, Karina. Again, doing so much. So great. Very, very cool, everything that WAAC and YACWA do. And then I'll just give a quick brief overview of where I'm working, which is at the Aboriginal Health Council of Western Australia. So AHCWA, as it's known, is the peak body for 23 of our member services, and we help to support them through many different things in the AHCWA sector. I just thought I'd touch on some of the training that we run out of AHCWA. So there is the Birds and the BBVs training, which is what that I run. We also run it in conjunction with WAAC and Hepatitis WA. So that's generally a 1 or a 2 day course, and that's looking at all things STIs and bloodborne viruses. And generally it's more linked towards like clinical people or people working with in the AHCWA sector or with Aboriginal people. And it's just looking at general overviews of STIs, treatment, testing, contact tracing, follow-up, all those sorts of things. It's really fun, interactive couple of days, and would highly recommend it. We've got EOIs on the website. We are running one in here at the AHCWA main office next week, and then we're taking it out to Kalgoorlie in August, but looking to take it across WA. So if there's any regions that would like to have it your way, just let me know and we can facilitate that. The Young Leaders is going through a rebrand at the moment, so I won't touch too much on that, but we're looking at moving towards a train-the-trainer model that will look at working with people that are working with youth and giving them the skills to have conversations around STIs, BBBs, healthy relationships, and those sorts of things. And then just to let you know, AHCWA also do run training on ear health and immunisation training as well. So we'll probably leave it at that because we are running out a little bit of time there. So beautiful. So I'll stop sharing and then we will come back in. Karina, give me an update. Are we back on board? Are we stopped sharing?
Yeah.
Oh, wonderful. Lovely. So I guess if anyone had any questions or any feedback on any of the designs, let us know. Also, if you're looking at getting, if you would like some condoms, you can access those through the WAAC website. Is that correct, Karina? Otherwise, you can just link myself an email and we can help facilitate that for you.
Just pop the link in the chat of where you can order the safe sex packs and it's all free. So yeah, please feel free to make an order there.
Fabulous. Thank you. Awesome. Thanks, Aaron. Great. I'll flick it through to you shortly. Great. Glad that you're happy with it. What else have we got here? Oh, Steph here with our amazing NSCP coordinator. They gave out 2.8 million injecting equipments in 2024. That is incredible. That's so cool. So great. Beautiful. So I reckon that's probably it. Thank you all so much for joining. Just to let you know, I'll be sending out an email shortly. We've got some other cool topics coming up. So at the start of August, we're doing a focus on congenital syphilis. And then later in August, we have got an hour special, which is going to be focused on someone from the Pelvic Pain Foundation's coming in. So we're going to have a half hour discussing that, and then on the back of that we're going to be discussing HPV, what it is, what the vaccine is, which I think will be a really cool hour there. So I'll send that out shortly, but thank you all so much for coming and we will see you soon. Beautiful. Thanks everyone.